Movement is the cornerstone of healthy circulation, particularly in the legs, because muscles serve not just to create motion, but also as a vital pump that drives blood back toward the heart. As we age, veins lose some of their elasticity, and valves within them may become less efficient, making it more difficult for blood to overcome gravity and return from the lower extremities. Every contraction of the calf, thigh, and gluteal muscles compresses the veins and gently pushes blood upward, a process often referred to as the muscle pump. This action reduces pooling, prevents stagnation, and improves overall venous return, which is essential for maintaining tissue oxygenation and metabolic waste removal. Beyond the mechanical benefits, regular movement also stimulates the endothelial cells lining blood vessels. These cells respond to the shear stress of flowing blood by releasing nitric oxide and other signaling molecules that relax vessel walls, reduce inflammation, and encourage flexibility in both arteries and veins. Even simple, low-impact exercises such as walking, leg lifts, or gentle cycling can activate these mechanisms effectively, making consistent daily movement more important than intensity. The rhythm of contraction and relaxation teaches the vascular system to respond dynamically to each heartbeat, enhancing perfusion in tissues that often suffer from reduced oxygen delivery in older adults. Over time, regular activation of the muscle pump contributes not only to improved circulation, but also to better balance, reduced swelling, and a decreased risk of complications such as varicose veins or deep vein thrombosis. The elegance of this system lies in its simplicity. The muscles, when engaged thoughtfully and consistently, act as both engines and regulators of blood flow. By understanding and leveraging this natural mechanism, individuals over 60 can take a proactive role in supporting their vascular health, ensuring that every step, stretch, or movement contributes to the efficient delivery of life-sustaining blood to the legs and beyond, demonstrating the profound connection between motion and cardiovascular well-being. Flexibility and mobility play a subtle but powerful role in supporting healthy circulation in the legs, particularly after the age of 60. As we grow older, joints stiffen, muscles shorten, and connective tissues lose elasticity, all of which can impede the smooth flow of blood through arteries and veins. Gentle stretching and mobility exercises help maintain the suppleness of muscles and tendons in the calves, thighs, and hips, allowing the vascular system to respond more dynamically to the rhythmic push of the heart. When muscles and connective tissues are flexible, veins are less compressed in awkward positions, and arteries can expand and contract more efficiently, improving blood delivery to distal tissues. Targeted stretches for the lower body, such as calf raises, hamstring stretches, and hip flexor mobilization, encourage both muscle elongation and joint range of motion, creating more space for blood to circulate freely. This practice reduces the risk of venous stagnation, which can otherwise contribute to swelling, fatigue, or even clot formation. Mobility work also enhances proprioception and coordination, allowing for smoother gait and posture, which indirectly supports optimal blood flow by minimizing unnecessary compression of vessels during movement. The benefits extend beyond the mechanical. Stretching stimulates nerve endings in the muscles and fascia, signaling the autonomic nervous system in ways that can relax blood vessels and improve overall vascular tone. Even brief daily sessions of stretching and mobility can cumulatively reinforce these physiological responses, promoting a rhythm of expansion and contraction that complements the muscle pump. Over time, this integration of movement and flexibility enhances circulation efficiency, reduces discomfort in the lower extremities, and supports the resilience of both veins and arteries. Through mindful engagement with stretching and mobility, older adults can actively participate in their own vascular health, creating a foundation for improved oxygen delivery, nutrient transport, and overall leg vitality. Circulatory health is influenced not only by movement and flexibility, but also by the nutrients that support the vascular system from within. After the age of 60,
arteries and veins often become less elastic, and inflammation can subtly accumulate along vessel walls, reducing the efficiency of blood flow. Certain nutrients play a critical role in maintaining the integrity and responsiveness of the circulatory system. Nitric oxide precursors found in foods like beets, leafy greens, and citrus help the endothelial cells lining blood vessels relax and expand, allowing blood to move more freely and reducing resistance in the legs. This effect is particularly valuable in older adults whose vessels may have lost some of their natural elasticity over time. Omega-3 fatty acids, abundant in fatty fish, flax seeds, and walnuts, provide additional circulatory benefits by reducing inflammation and improving the flexibility of both veins and arteries. Chronic inflammation can stiffen vessel walls, slow circulation, and increase the risk of vascular complications, so incorporating anti-inflammatory nutrients supports the body's natural repair processes. Antioxidants, such as vitamin C, vitamin E, and polyphenols found in berries and dark chocolate, protect endothelial cells from oxidative stress, preventing cellular damage that can compromise blood flow. Even minerals like magnesium and potassium influence vascular tone and fluid balance, ensuring that blood pressure remains within healthy ranges and that circulation is not hindered by constricted vessels. Together, these dietary strategies complement physical movement and stretching, forming an integrated approach to improving leg circulation. By paying attention to what nourishes the blood vessels and supporting them with targeted nutrients, individuals over 60 can actively maintain vascular health, enhance oxygen delivery, and reduce discomfort in the lower extremities, demonstrating that nutrition and circulation are inseparably linked in sustaining vitality. Beyond exercise and nutrition, simple positional strategies and supportive techniques can profoundly influence blood circulation in the legs, especially for those over 60. Gravity naturally encourages blood to pool in the lower extremities, and as veins and valves age, this pooling can become more pronounced, contributing to swelling, discomfort, and even varicose veins. By consciously elevating the legs above heart level for brief periods throughout the day, the force of gravity assists venous return, allowing blood to flow back toward the heart with less resistance. Even a few minutes of elevation while lying down or resting in a reclined chair can reduce venous pressure, relieve edema, and provide immediate relief to fatigued legs. Compression techniques, such as wearing gentle support stockings, offer another layer of assistance by providing external pressure that helps prevent blood from stagnating in the lower limbs. These stockings are carefully designed to apply graduated compression, tighter at the ankles and gradually decreasing toward the knees and thighs, supporting the natural upward movement of blood. This simple intervention can reduce swelling, minimize discomfort, and decrease the risk of venous complications without requiring intense physical effort, making it especially valuable for older adults who may have mobility limitations. Even the way one sits or stands throughout the day affects circulation. Avoiding prolonged periods of immobility, crossing legs for extended durations, or sitting in positions that compress veins can significantly improve blood flow. Small adjustments such as standing intermittently, flexing and extending the ankles while seated, or incorporating short walking breaks allow the calf muscles to engage and support venous return naturally. These small adjustments flex and extend the ankles while seated, or incorporating short walking breaks allow the calf muscles to engage and support venous return naturally. These positional strategies highlight the elegance of combining external aids with the body's intrinsic mechanisms. By understanding how gravity, compression, and posture influence venous return, older adults can take proactive steps to maintain leg circulation, reduce discomfort, and complement the benefits gained from exercise and nutrition. These subtle interventions demonstrate that even minimal intentional actions can significantly impact vascular health over time. Lifestyle habits extend far beyond movement, stretching, and nutrition. They shape the very environment in which blood circulates through the legs. Stress, for example, has a profound effect on vascular health, as elevated stress hormones like cortisol can constrict blood vessels, increase blood pressure, and impair microcirculation. By incorporating stress-reducing practices such as deep breathing, meditation, or gentle yoga, the body signals the vascular system to relax, allowing arteries and veins to dilate and blood to flow more freely. Over time, these practices help maintain vessel elasticity and improve overall perfusion, creating conditions that support healthy oxygen and nutrient delivery to the tissues of the legs. Regular cardiovascular activity, even at moderate intensity, also integrates seamlessly into this lifestyle approach. Activities such as brisk walking, swimming, or cycling stimulate the heart to pump more efficiently, increasing cardiac output and promoting consistent blood flow throughout the body. This kind of movement strengthens the cardiovascular system, encouraging the vessels to remain flexible and responsive.